Hi, I'm Dr. Dawn Thomas. I am a spine fanatic and a movement artist. I happen to have a doctoral degree in physical therapy, and I love to help cause professionals learn about their bodies, overcome stiffnesses and pain in order to have a more resilient body and a pain free career. So I'm talking to you today about some strategies that we're going to learn on how to do just that, how to build resiliency in your body so that you can have a longer, pain-free career and enjoy your work days and feel as great as you make your clients feel. So the most common problems that I've seen in my career with professionals that work on hair, work on makeup, nails, kind of like any of those salon type services, a lot of people with neck pain, upper back pain, lower back pain, shoulder problems, or headaches. These are just sort of the top list of things that I have seen over and over again with people that have those types of careers, and it's very difficult to overcome when things kind of snowball and one thing starts hurting and then the other thing starts hurting and things start breaking down, and it's hard to sort of double back and try to figure out, okay, how can we get this under control so that you have a little bit more resiliency in your body so that you can keep on doing what you do. So some of the reasons that I think this happens is most professionals that I've worked with in therapy work long hours. They tend to be in static positioning. And by that, I just mean you utilize the same position for long periods of time. So whether it's standing with, minimal changes, you're not walking, you're standing, or if you're sitting doing nails, you're sitting in a very specific position. Um, Whichever service your expertise is, you tend to have positions where you have to maintain that position for long periods of time. Also, you tend to be, from my observation, very service oriented. You're in a service business. It's part of your service to make your clients feel good. And so you tend to be very accommodating to them. And sometimes, this can be of sacrifice to yourself. We as, our type of, in the therapy profession, we are like this also, very similar in that, we're sort of sometimes sacrificing our hands and our joints in our hands because we want the person to feel better. We want to make the change in their life or their pain or their mobility or whatever it is we're working on, and sometimes put ourselves at risk by using our thumbs too much or by kind of bending or lifting in different positions that maybe aren't so great for us repeatedly. So I feel like that's also a similar cause professionals. You're servicing the person, you're making them feel better, you're making them feel like they're coming into you for an experience, and they want to leave feeling confident and pampered a little bit and all of that. So you tend to maybe put your body in positions that maybe isn't the best because you don't want to make the person uncomfortable, like, make them get in an awkward position because you put yourself in a position to accommodate them. Um, okay, so let's talk about posture. What does poor posture and static positioning do to the neck and do to the shoulder? So it's hard for me to be very brief when talking about the anatomy of the neck and the shoulder because there's a lot of detail, and I'm a spine fanatic, so I find it fascinating. So here's my spine. So here's our spine. Here's the back of the skull. This is the front of the body. This is the back of the body. Actually, I think I can make myself bigger. And yeah, that's not bad. And if this is sort of a good posture, right? The spine is supposed to have a little bit of a curve here and a little bit of a curve here. Then all of this, maybe I should unblur. All right, that's better. I unblurred. Okay, so this is what we would call a neutral posture, okay? This is a normal lordotic curve, a little bit of a curve in, normal thoracic curve, a little bit of a curve out. And when we get into bad posture, so in this case, usually the most common poor posture is we tend to kind of slump down here with our shoulders, and then that ends up putting our necks kind of in this position. So we end up in a position like this and this. So if you look here, if you look at what my neck is doing and my upper back is doing, it's just over exaggerating that normal curve like that. And then what happens, this isn't that flexible. So what happens when you do that is you close down all these spaces here. So nerves, arteries, little tiny joints up and down the spine. These are called our facet joints. Very common to get pain in the facet joints and compression in the nerves and the disc joints. So it's essentially a matter of space. Compression, more or less compression, is what tends to generate pain syndromes and stiffness syndromes and things that become accumulating and chronic. Because if we are constantly in this exaggerated poor positioning, that's constant compression on these joints here and on these nerves and arteries and discs, and everything's squished down. It's sort of like you're pushing down on it. When in reality, so then you stay in that position for hours at a time or days at a time, then those tissues never have a chance to recover. And so this is why in the neck, this is so important to learn how to make that adjustment to maintain a better posture, to be able to make sure that you have the mobility in your upper back and your neck joints and your upper back joints and all the muscles in the front of your chest in order to maintain this tall position where you have a slight curve, but not a exaggerated curve. So compression in that neck, all those joints, ooh. And then elongation is going to decompress. So just by lengthening my body, I'm decompressing all those structures in there. So now in the shoulder, it's a similar concept. So the shoulder works like there's actually a cup, and it's called the ball and socket joint. So it looks like this. And my arm, this is the ball of the ball and socket, and my arm moves and the ball rolls inside the socket. Now we have tendons and muscles that kind of wrap around our shoulder around here and come right in here. And when we raise our arms, we run out of, there's limited space in the socket, right? And if we have stiff shoulders, we tend to sort of grind these muscles and tendons in this limited space. So what happens when we have poor posture or static positioning? So In some cases, when we are, if we're, working with our hands here, if we're cutting in this direction like this, we're, I'm not doing it correctly, but this common positioning that I see with the, you know, this here, this exact positioning is what we call an impingement position for the shoulder, because it just happens to be geometrically the position that the rotator cuff tendons tend to run out of space and jam up into that. I call it a tunnel. It's a subacromial space, but this happens to be that impingement position that puts those tendons at risk of kind of grinding down and getting chronically rubbed on. So at first, it's no problem, because if I don't have any inflammation or I don't have any pain or nothing's going on, but I do that over and over and over again and hold it there statically, then when I do develop some weakness or some inflammation, then that's going to become grinding, and you're sort of like basically taking a file to those tendons and creating a little bit of a chronic irritation. So that's just one example of why the static positioning can be easily irritating for the shoulder joints and muscles, and for the neck joints and all the structures in the neck, joints, ligaments, nerves, tendons, very sensitive in the mid neck from this sort of slouched positioning. Lots of reasons we tend to do that positioning. But we want to, those are, sometimes it helps to understand what's happening when we do that, because then it helps us understand how important it is to try to maintain that light, tall posture. All right, so when we talk about trying to look at people's workspaces and kind of their work habits and their, this is just the one thing that I have noticed when working with people, that usually you can make a small adjustment. Most people are pretty aware of this, but if you just really look at the height of the chair, if you're the professional that's standing and working on someone's head, whether it's from the front or the back, or you're working on the face or you're working on the hair, you are making sure that you have the person as low as they can be, especially with the longer hair. Because the longer you pull that up, the higher your arm goes and the further you are in that impingement position. So that's just an example of trying to be mindful of that and make them readjust to what you need. So if for a portion of their session or during their cut, let's say just use the long hair cut for an example, when you're at the phase that you're doing the kind of pulling the section up high, maybe you ask them to sink down in the chair and slide their butt forward so their head sort of comes down for you temporarily while you're doing that part of the cut. So that's just sort of, and it can be worked through individually, but that's just sort of one tip to kind of put in your head to kind of experiment with and see if you think it makes any difference. Okay, so now we think about what are the reasons why I'm not keeping a good posture. So why am I find myself in this sort of position like this all the time? So this is a very oversimplified way of looking at it, but it's one way to look at it so that we can start some active problem solving and some actual doing to address some of these things. So we can do a quick screening test to basically identify if you are primarily a flexibility problem person or primarily a postural strength problem person. So I can sort of categorize a person into what makes it difficult for someone to maintain this ideal posture. And the ideal posture is going to be where I'm just showing this in sitting at the moment, but where you're, because we're focusing on the neck and the shoulder and the upper back, but standing's a whole nother conversation. But in sitting, we're going to think about the ear being lined up with the tip of the shoulder. And those would be the, for simplistic sake, for this purpose, this would be the two things we're kind of looking at just in sitting. If you just think about how lined up is my ear with the tip of my shoulder. Okay. So then I think, well, why can't that person get the ear lined up over the shoulder? Sometimes it's because the muscles on the back of the body, the back side of the body, aren't strong enough to maintain that position, to maintain that posture. And sometimes it's because the muscles on the front side of the body, or joints or muscles on the front side of the body, are too tight. And when I try to open up, I'm pulling on them, and there's too much resistance. There's too much stiffness in either the muscles in the front or the joints in the back in order to lengthen my body enough to get that alignment. So we do a quick screening tool where you're standing up against the wall and sliding the arm slide test on the wall versus on the floor. And if there's a huge discrepancy between your mobility when sliding the arms up the wall versus sliding the arms on the floor, then we know that it's a strength. That is primarily we're going to tackle a strength approach first. Then we'll tackle the flexibility approach, and vice versa. And if the slide on the wall is similar to the slide on the floor, or not a huge discrepancy, then we're going to start with a stretching flexibility problem approach first. So it just gives us a simple way to come up with a starting point. And we'll do it together. So if we find that we always want to address both, though, because you're not going to maintain your flexibility if you don't address your muscle activation or your muscle strength or endurance. So these would be the four most commonly tight muscles that I chose them because they're commonly tight and tend to put us in a poor posture, and they're easy to do anywhere you are, at work, at home, in the chair. You can do them kind of on the move. You don't have to have special equipment or to be in a certain space. Now, when we choose things to address the postural strength deficit or problem, we're going to also choose 6 things that you can do, again, on the fly, on the move, with easy little loop bands we're going to use, and teach you an incline push-up that is going to be, you can do on different surfaces. So each grouping we can do no matter where you are. You don't have to be in the gym. You don't have to be at home. You can be at home or work or anywhere, so that you can incorporate these into your day. Perfect to do 1 or 2 of these during break times or in between clients. Perfect to do in between clients. Just 1 or 2 of them. Doesn't matter which, or it depends on which one you end up in the strength or the mobility category. But just doing 1 or 2 of them for 30 seconds to a minute, not kidding, can help make your body more activated, more posturally aware, more placed in that safer position, so that as you're working and doing things, you are not putting those those sensitive structures on compression all the time. So it doesn't have to be complicated. You can do these things on the fly. You can do one exercise for 30 seconds. You can do one set of 15, move on to your next client. You can do them together as a team for 5 minutes in the morning, for 5 minutes in the afternoon, or something to try to find a way to integrate it into your day. One way to try to make that stick, habit stacking. If you can find something that you do constantly, that's a habit that you don't think about it. It could be sweeping around your chair. That'd be a perfect one. Sweeping around the chair. Every time I sweep around the chair, I'm going to do my pec stretch with my broom. So that's a habit stack. So it's adding a new habit that you want to habituate into your day to a regular habit that's already habituated into your day. So you could take two of them and you could say, every time I get a cup of coffee, I'm going to do my trap stretch or my bow and arrow. Pick one movement. So you get your cup of coffee, already habituated habit, add a habit stack to it. I'm going to do 10 bow and arrows, and then I sweep my hair. I'm going to do one pec stretch and move on with my day, and you will feel better. It doesn't take a long, complicated workout deal to make an impact on how you feel throughout any given day. So I encourage you to try some of these and try as best you can to try to incorporate it. And even if you don't have current problems, these are preventative. These are preventative so that the tissues in your body don't break down, and you can start to kind of be a little bit more sturdy and not be as fatigued, feel taller, feel younger, feel more statuesque, one of my favorite words. And I hope that you find this helpful, and I'm excited to have you try it. And I look forward to looking at you in person and taking a look at how we can help you learn these movement patterns and build it into your day. Thanks for listening.